Hey guys, it's Carly. So we're actually going to be filming this video on my stairs because the lighting in my room is awful right now, and as much as it's weird for me to know that people are literally watching my face, I figured if it's going to be there, you might as well see it. So we're on the staircase. If you hear random grunting, it's my dogs. They're being really good right now and just kind of sitting here, but they're little, so who knows what they're going to do. So this is actually going to be the first part of the surgery request video. That's actually Starsky. You can see him creeping in the corner. So I'm going to divide the surgery stuff into kind of two parts. One is going to be this part, which is going to be actually talking about the process. And then the second one is going to be mostly about the book my surgeon gave me, but I'll probably also do the first couple of days or the first week or so after the hospital in that one too, because I mean, nobody wants to sit here and watch me for 30 minutes. So you're welcome. Also, thank you to everybody who solved the mystery of the subscribers. It was, again, Lynn being awesome and mentioning me. So thank you so much, Lynn, and to your subscribers who came on and decided to stick around. And to everybody who helped me with the comments. It actually wasn't me being not smart, apparently. So I used the YouTube app, and I guess I needed to either use the YouTube website or switch to my iPad to do comment replies. So thank you so much to everybody who solved both of those mysteries, because now I feel way better. Okay, so when it comes to bariatric surgery, one of the biggest things people look for first is whether or not their insurance covers it. For me, I went through United Healthcare. I'm really lucky. My employer is fantastic and my health insurance plan is amazing. So we actually have a bariatric rider. And what that means is that my employer basically pays extra every year to cover bariatric surgery. So for me and my plan through my employer and the option I picked, so really specific, I basically had 90% of my surgery covered after my deductible. And then I had to pay an extra fee to the hospital itself for all the hospital stuff because I hadn't met my, it's like an in-network deductible thing. I don't know. So I did my copay and everything was fine because my copay is super low. But I have other friends who had surgery at the same facility with the same surgeon I did, and we all had to pay the same hospital fee, even though our surgery fee was different. So take that for what you will. But yeah, so I had surgery at Rockwood Medical Center in Spokane, Washington. They're a center of excellence, so my insurance was super happy to deal with them. And for me and my insurance's requirements, some of the things they needed was that I needed to be on a 6-month supervised dietary, which basically means that once a month for 6 months, I either met with my primary care provider, or my surgeon's team to weigh in and talk about my progress and the changes I was making. I have a background in dietetics, so that's why my dietitian through my surgeon's office didn't make me work with a dietitian or a nutritionist, because I have a pretty good understanding of food and how that works and what to do. So I did it with my primary care provider. I ended up having, originally it was supposed to be that I had 4 appointments with my primary care provider and 2 appointments with my surgeon. It actually ended up being an even split because my surgeon wanted to see me an extra one. In that time, I cut out all carbonated beverages. I think in that 6-month period, I had 3 or 4 carbonated energy drinks, and I think I had soda, diet soda, once or twice. Sparkling water was the big one, so that was what was really hard for me to cut out, but I did. I also cut out nicotine, so I quit smoking a while ago, but I've been vaping. So when I first started seeing my surgeon, I think I was at 18 milligrams of nicotine in my vape. By the time, I think it was 20 or 28 days before my surgery, I was down to 0 milligrams. So I still vape, but there's no nicotine there. So for me, it's kind of like an anxiety reliever thing. But I haven't switched back to nicotine. And honestly, for the first 2 weeks I was home, I didn't even need to recharge my battery, if that tells you how little I use it. But it's nice to have. I also cut out caffeine, which I was very angry about. Caffeine basically became like you're going to go away now. I think the last week of my liquid diet, I'd had coffee at Starbucks a couple of times, and both times it made me feel really sick. And after that, I didn't want caffeine anymore. It's amazing. So since I got cleared for caffeine, which happened at the 3-week mark. I've had caffeine in energy drinks, in protein shakes. I have a few protein shakes that have the equivalent of a cup of coffee of caffeine in them. And I've drank those without issue, but when I've had coffee, it's been decaf. And I haven't switched back to regular coffee because I'm a little scared. And iced tea I've had a couple of times, but I can't drink more than 2 or 3 ounces of it. So I don't know if it's the nicotine. There's no nicotine in iced tea. Okay, I don't know if it's the caffeine or not, but it hasn't been great. So those were the big things I tackled, or that were kind of issues for me during that 6-month time. I'd also had a full list before I even met with my surgeon of every diet and weight loss effort I'd made in my life. Apparently it's one of the longest ones they've ever seen. I also needed to have a weight history of the last 5 years. And so I moved around a lot about 3 years ago. Yeah, 3 years ago. I went through a pretty terrible divorce and spent basically 8 months in 3 different states. So in that time, I saw a bunch of doctors. And so I had to gather basically weight histories from 3 different states from probably 15 or 20 doctors just to make sure I had all the information there. Apparently something slipped through the cracks. And so even though the last time I saw my surgeon was in July, for some reason they thought they didn't have all of my medical records, and they did. So when I called them in September, they cleared that up and submitted it, and I got approved. And that's why I have a December surgery date, even though I started the program in February. You know, everybody makes mistakes, and my file was huge. Like huge. So I get it. And I'm glad that we were able to kind of figure it out and resolve it really quickly. I don't live in Spokane. I live in Eastern Washington. So I live like 2.5 hours away from Spokane. So basically, whenever I would go in for my appointments, if there was anything else we needed to do, like my GI pressure test, which was awful, or my gallbladder scans, or my pre-op orientation consultation class, whatever. I basically did it when I had those appointments. But for most people, they probably wouldn't. They tried to accommodate me living in a different place, which was super nice of them. So because I did live in a different place, I basically had my initial surgery visit. The orientation was done in my city because we have a bunch of people who go for surgery there. So I had my initial surgical visit, which also counted as my first medical in Spokane. And then I had visits 4 and 6 in Spokane. And then I had my pre-op visit, or my pre-op checkup, whatever, which basically they checked to make sure that I hadn't gained a crazy amount of weight, and that my file was up to date, and that they had all of my information up to date. And so I did that, and then I did the 2-hour orientation class right after that. And that was 3 weeks before my surgery instead of 2 weeks, because my surgeries, I can't even speak English. The 2-week mark before my surgery was December 28th, which was right after Thanksgiving. So we decided to do it a little early so I would have everything I needed to get through kind of the craziness. And then I just started my liquid diet on the 28th. Which, if you want to know how much I love that and you haven't seen them already, go check out those videos. I was not a fan of the liquid diets. And I mean, it got better the last few days of it, but I think that's more because I no longer wanted to eat or drink anything. And I kind of had just given up. But yeah, so the last appointment I had with him was the 21st. Then I started my liquid diet the 28th. I went to Spokane on December 11th, and we stayed overnight. I brought my mom, and my roommate drove us. So my roommate is a former romantic partner, and he's came to a lot of the other appointments. So he drove us, and then he came back when it was time to come home, and he drove me back home. Checking into the hospital was weird. It was super early. I think it was like 5 or 5:30 in the morning because I was the first surgery of the day. And so, I mean, like, we were ready to rock at like 6 or 6:30. So there are a few things that my practice does that's really fantastic. So at the pre-op appointment, I was asked a bunch of questions that I wasn't expecting. So I have a history of generalized anxiety disorder, meaning that hormonally and chemically, my body doesn't understand when it's in danger or when it's not. So my fight and flight are basically all messed up, which means that if I'm in like a crowded room with a bunch of people I don't recognize, or I'm in an unfamiliar environment, or just certain weird things, I get really triggered and I kind of freak out and need to go to a different place. So basically my body is telling me that I'm being attacked and I need to leave, even though everything's fine. I have my own coping mechanisms for it. I've been doing really well with it. I am 34 years old and I've had it since I was 18. So my coping mechanisms are really fantastic, and I've done a lot of therapy and I've had medications before that have really helped. But because I have generalized anxiety disorder, one of the things they asked is if I wanted to be given some Ativan before surgery, just so I didn't freak out or stress out during the process, which I thought was a really nice ask. Sorry, my dog is smelling the door and I don't know why. Starsky, come here. Okay, focus time again. Another thing they asked was if I wanted to have, I think it's scopolamine, whatever. If I wanted to have an anti-nausea / anti-emetic be administered via a patch behind my ear before surgery, which, by the way, was fantastic. I know a lot of people complain about being really nauseous from painkillers and after surgery and blah, blah, blah. I think my first bout of nausea in the entire process hit 2 weeks post-op when I tried to drink water. So the patch super helped, and it was tiny, and it was great. Some of the other things, the IV went in really smoothly. I have really small veins that break a lot because I have a very long history of epilepsy. I don't have it anymore, but when I was a kid, I had to have weekly blood tests, and so my veins are terrible. So they got the IV in on the first shot, and they actually numbed me first, which I appreciated. The weird thing that happened, and I haven't heard anybody else describe it, so I don't know if it's like a new thing that people just don't mention, or if it's my surgeon's practice, but because I was staying overnight, they swabbed the inside of my nose with iodine to prevent MRSA, which is basically like an antibiotic-resistant staph infection, which is terrible and can kill you really fast. So I very much appreciate the precautions being taken for me not to get MRSA. But having your nose swabbed a bunch of times on the inside with iodine is a little creepy and kind of terrible. It was literally like they took a giant Q-tip and dipped it in liquid iodine and just like swabbed inside my nose and got in there, and they had to do it twice, and just, so if they tell you that, like, go along with it, because MRSA is terrible, but yeah, it's really uncomfortable. Thankfully, the nurse realized that I was super uncomfortable and joked that my mom had to have her nose swabbed too. So it was nice kind of seeing my mom freak out a little bit because I'm a terrible person. And after that, they gave me, I think it was, it was Versed. They gave me Versed, and I really don't remember much after that. I remember waking up. It was the first time I've had surgery that I hadn't woken up in shock, because pain medication tends to wear off really quickly on me. So that was nice. And then I had a lot of pressure in my chest and my back, and I had a really sore throat from the intubation, and then I got wheeled to my room, and we started the rest of the things. So surgery apparently went faster than they expected. I had a hiatal hernia, so they estimated that surgery could have taken as long as 5 to 6 hours, and I think it took like 3. So that's good. That's always a good sign. And I have 5 incisions on my stomach. I'm a little not concerned. I am self-conscious about them because I feel like I look like I got stabbed a bunch of times. But as they're healing, they're definitely getting less noticeable. And I mean, I have a stomach that has like stretch marks and puckering and stuff on it anyways. So hopefully as I get smaller and as they heal, they'll become a lot less noticeable. The only other surgery I've had that has left a scar is I had a tubal ligation about 4 years ago, and my scar is inside my belly button. So like I knew I would have incisions, but I guess I kind of didn't realize how bad they would look for the first couple of days or the first week or whatever. So that's getting better now. trying to think what else about the hospital. Honestly, like, the surgical part of it was the worst part of my experience so far, and it was way better than what I've heard a lot of other people describe. I don't know if maybe I just have a high pain tolerance, or it went really well, or my surgeon's fantastic, or a combination of all of the above, but I really, like, it's been pretty good. There's things that I still struggle with, and things that are hard. Like, it's hard for me to walk my dogs. So my mom did it when she was here, and my roommate does it now, because it's hard for me to bend down for extended periods of time. And so, like, I can't clean up after them. But apparently that's normal. I still have a lump in my throat from being intubated. Food and liquids are my gauntlet, which apparently is pretty normal. But yeah, I mean, I don't think I'm losing a tremendous amount of weight or anything like that. And I don't think, like, I woke up a different person. But I'm really happy with the way it's gone so far. And the book they gave us was really comprehensive. I think I've referred to it about 17 million times. So I will show you guys some parts of it later. Just so you can see, every practice is different. Every surgeon is different. A lot of people on their liquid diets could have a meal of lean protein vegetables, or they could have yogurt, or they could have soups, or whatever. I was allowed protein shakes and broth and sugar-free popsicles and sugar-free Jell-O, and that was it. So I'm going to show you guys some pages of, like, the dietary plan. That doesn't mean that that's the dietary plan you should follow. Follow what your surgeon recommends. And, like, don't deviate from it, in all honesty. Every surgeon uses, I would imagine, similar techniques. But I think what happens and why some of the plans are so different is they take their patient histories into account to kind of see who heals the best and who has the most success. And they form their plans around that, and they update their plans around that. So if your surgeon sees success with something that maybe my surgeon didn't, that doesn't mean that your surgeon's right and my surgeon's wrong, or vice versa. It just means they have different plans. So if there's anything you see that you think you want to do, instead of just doing it, ask your surgeon. Most surgeons' offices have a nurse or a nurse practitioner that you can call to kind of just be like, hey, I have these concerns. What do I do? And they're happy to answer your questions. I called about doing things like water aerobics because I hate walking. And I didn't get cleared for it. But I had a nurse I could talk to in real time and be like, hey, so I want to do this thing that might be stupid. Before I do this stupid thing, can you tell me if I can just not? And it's that simple. Everybody's doctors recommend different kinds of vitamins and minerals, different kinds of vitamin protocols. Most should be pretty much the same. The only things I was advised against were gummies because they stick weirdly to your pouch or your sleeve or whatever. And the vitamin patches because they don't absorb into your skin really all that well. So vitamins and minerals and stuff absorb in certain parts of your digestive tract at certain times with certain parameters because that's how your body is built. So one of the reasons why, like, naturally it's always recommended to get your vitamins and minerals from real food is because that's what your body can absorb. And that's the most biocompatible. When that fails, or when you need help or you need a boost, that's where vitamins come in and supplementation. So with bariatric patients, we need supplementation. So don't think of vitamins as something that is an expensive part of the process and it's a recommendation. Think of it as somebody who has, I don't know, high blood pressure or diabetes. Imagine, so not taking your vitamins as a bariatric patient is the same as a diabetic not taking their insulin. We don't take them because it'll help us be healthier. We take them because we need them to live. My body no longer synthesizes certain things or makes certain things. And so I have to give it those things to make sure that it's healthy. If I don't take my calcium, my bones can break. I could lose teeth. Like, those aren't things that normally happen to a 34-year-old. They can if I don't take my vitamins. So with the vitamin patches, yes, I would say that probably a portion of the vitamins in there are kind of absorbed subcutaneously or through your skin. The amount that we need is so high compared to a normal person, there's no way in hell that your body will absorb it all through vitamins. And I don't want to start a debate because everybody views this differently and people will say, but my panels are fine, and that's fine. Like, if your doctor is telling you you can take them and your panels are fine and you're not seeing any side effects, like, live and be well, like, do you. But I wouldn't trust them. And with vitamin deficiencies, especially if they're fat soluble vitamins, like vitamin A, D, E, K, vitamin B12, it can take months for any deficiencies to show up. So just because your panels are fine now doesn't mean that there's not something going on. Doesn't mean that you won't wake up one day and be super fatigued because you don't have B12. So like if you want to take patches, take them. I'm not going to. So yeah. So I'm gonna film another video later on with the book, but I'll upload this one now so that way it's there because I'm already late on it. Sorry. And yeah, thanks for being awesome, and I'll have the next video up probably tomorrow. Have a great day.